I'm Ashley Wagasback, feeding therapist, occupational therapist, and lactation consultant. Look forward to discussing all things feeding so that we can support you to bring your little one to their maximum potential so that feeding can be enjoyable for the entire family.
Are you looking for a community of other moms joining together to support their little one through the ups and downs of feeding and gross motor milestones? The Thriving Together community is just for you. Find us on social media at Instagram, Facebook, and www.sensorysolutionsTherapy.com to learn more. We look forward to seeing you.
Hello, everybody. Welcome back to another episode of the Feeding Solutions Podcast. This is a big one. I have been chasing her down for a long time. My sweet friend, Ashley Larson. She is a dynamic leader for sure, and she is the owner of Bodyworks Specialists. She's a physical therapist with a huge heart. She has a lot of curiosity. She's so incredibly creative, finding solutions to the most complex challenges, and my children are among them. She's earned her bachelor's degree in kinesiology from LSU and her master's of PT from the University of St. Augustine in Florida. She is NDT certified, and in 2016, she made history as becoming the first physical therapist in Southeast Louisiana to become an orofacial myology therapist. And she continues to lead in this field. I have firsthand experience with that, and then again in 2019, she became the first PT in the nation to become a board certified orofacial myologist. She specializes in the lifespan from infants, breathing disorders, patients with multi-complex issues going on, and she helps people to eat, breathe, sleep, and move better. And when she's not busying herself at her clinic, she is loved by her amazing husband, Scott, and their 3 boys. So thank you so much, my friend, for being here.
Ashley, that was sweet. That was really, really sweet. I love
Wow.
that. Thank you.
Absolutely. I'm so happy to have you here. I know you need no more attention brought to you, but this is my little way of thanking you for how you have saved me in many times and helping my children to be just the better versions of themselves. So tell us a little bit about you and the work that you're doing in your clinic as far as from infants to seniors, all under one roof. That's pretty unique in itself. So,
Yeah. Didn't think I would be doing that. So the story comes out. I started this years ago. I was an early intervention therapist and always on a feeding team and just kind of rolling along. And then all of a sudden I had babies. And everybody kept saying that I kept looking at things. I was like, that doesn't look right. And but they would say, oh, he's going to grow out of it. He's going to grow out of it. He's going to grow out of it. And then all of a sudden, we're just doing life. And my youngest was 8 years old, didn't tolerate palatal expansion one summer, and he changed. Like all of a sudden went from not wanting to read out loud to me, not wanting to eat at the table, talking with his hand over his mouth. And I was like, well, something's not right here. So, a good friend back home, we started like looking on the internet and saying, okay, what is there? And found this quote unquote myofunctional therapist out on the West Coast. And I called her and I said, hey, can I just show you pictures and have like a little eval through telehealth? She's like, yeah, I mean, my functional therapy is just physical therapy for the mouth. I was like, I am a physical therapist, so we're going to give that a whirl. Now, what, 12 years later, this is what I'm doing. Never in a million years did I think I would be doing this. But yes, now my clinic sees everyone from infants to 75-year-old humans. And it's all, everyone, the connection is that everyone breathes, everyone speaks, everyone has to eat, and everyone talks. And so it's trying to find the impairments in those areas of function and trying to correct.
yeah. And it's so unique because being a physical therapist, looking at the entire body, And so, again, can you maybe break it down a little bit more? Like the mouth breathing, the snoring, the teeth grinding, the attention issues, the posture issues, like how is that all related? Break it down
Sure.
for our little minds who might not understand.
Sure. So I don't ever speak in absolutes because, just because you see grinding doesn't necessarily mean that there's an airway dysfunction. Um, and I'm certainly lead and practice in the gray. I don't, just because you see one thing doesn't necessarily mean the other. However, in Louisiana, a lot of times these kiddos come to us with chronic nasal congestion. So can't breathe through their nose, whether it's because the azaleas are blooming or the 35-year-old that just had, 6 pounds of crawfish and then ate all of the crawfish spread and all of the things at the table. And so their nose, oh, and the beer that goes with the crawfish. So, that will inflame the nose. But chronically, if these kiddos are just congested, thick mucus congestion, that is not going to let them breathe through their nose. And then they're going to be mouth breathers. And then when you get mouth breathers, then you get, sorry, I'm going to push you over here. Then you get issues with potentially occlusion and certainly, breathing dysfunctions. And then you could get snoring because the tongue's not sitting where it's supposed to, right? Soft palate's not doing what it's supposed to. Nose is not doing what it's supposed to. So then you get snoring and then you get a sleep issue. And then sometimes you get behaviors that manifest when you're not breathing right and you're not sleeping right. And so they can all connect. And there's some really good research that shows that behavior issues are related to sleep issues. And so you always want to rule out, is there something going on in the day that's
Mhm.
manifesting at night too, that could be contributing to issues that you're seeing in daytime behavior?
Do you feel like there's an epidemic of kids who are being misdiagnosed with, like, because this airway piece is a really just, it's like we're at the forefront of this. Do you feel like there may be a population of kids whose parents are like the meds, we're bouncing from one to one, nothing's
Right.
working? Do you feel like maybe this should be something they should consider or just
100%.
educate? Yeah.
100%. I think everyone, so sleep disordered breathing, the breathing, sleep dysfunction and
Mhm.
breathing dysfunction. It doesn't just happen at night. It starts during the day, right? And it's just manifesting at night. So you always want to make sure that breathing is optimal and that these kids can rest well so that they can function well during the day. Do I think that it's the sleep disorders are not being diagnosed and that these kiddos are having behavior issues? Is that pronounced? Yes. And I would always like to rule out there's a sleep issue before it's just one of the pieces in the puzzle, right? So, um, yeah, I wish
Well,
that they were looked at a little bit more.
yeah, and I feel like that's what's so unique about the lenses that you look at it. It's a different way of looking at how a person's functioning. So you're the
And it could
first,
be anything, right? It could
yeah.
be,
Hmm.
it could be just a little bit of this, a little bit of this. I mean, Ashley, if you don't sleep well one night, you are one warning everybody during the day, like short fuse. Today's not the day to really get on mom's nerves. You're gonna plan to go to bed earlier. You're gonna maybe have that extra cup of coffee in the afternoon or that sugary snack to keep your energy up because you've got to function. And then you're planning, I'm going to take my bath earlier. I'm going to get in bed. I'm going to read. It's going to be quiet and I'm going to go to sleep. But you've done all of those little things to help your system do what it needs to do during the day and then plan for a better night. Kids don't have that language, those words. And so a lot of times they'll just spin during the day until they absolutely crash at night because they just don't have the language or the understanding of that's what's happening, or they can't ask their mom for what they specifically need. So I always want to say, like, can we help that? Or is there anything there that we need to start looking at?
Yes. Yeah. And it's something that I've started incorporating into like all of my evaluations with kids, just like a quick little screener, because a lot of times parents haven't even looked and considered that as
Right.
being one of the reasons why things might be not quite in sync. So
Right.
I just
Right.
appreciate that that's something that's being talked about and bring to the attention of parents, because there's a lot of easy things that you can just incorporate into your routine that can make a huge difference for
Sure.
sure. So
Sure. And like snoring. So I know that we have talked about this a gazillion times, but if a mom sees a baby snoring, or anybody really, every once in a
mhm,
while, if you've eaten the crawfish bread or your nose is congested because
mhm.
you're sick, that's fine. But if it's chronic, then that is an issue, and we need to probably pay attention to that.
Yeah, yeah. And just because it's common doesn't mean that it's normal.
Thank you. Yes, just right.
And in South Louisiana, everybody has some level of dysfunction
So
because of
that
where we live, you know?
So that's why I started seeing adults. Never in a million years. If you would have said, Ashley, you're going to have adults on your caseload, I would have said, absolutely not. But
Hmm.
you're treating these babies and that have the nasal congestion, soft palate dysfunction. And then all of a sudden the mom's like, well, heck, Ashley, I mean, everybody in my family snores or everybody's on CPAP. And you're like, and then they're like, well, can you help them? And I was like,
Help,
I don't know. Let
help,
me let
right?
me let me give it a whirl. So
Hmm.
it's
It's
definitely
true.
very, very prevalent.
Yeah, absolutely. Okay, so you're the first oral myofunctional therapist that I've interviewed. So, like, what is
Wait,
that?
seriously? I
Yes.
love that. What is that? Okay,
What is it?
so I don't know. I don't know. It for me, it has a great term, right? The myofunctional therapist or orofacial myologist, which is the same thing. It depends on who you've been trained by, what you're considered.
Okay.
And I've been trained by both because I'm a continuing ed junkie. Um, I myotherapy in like your traditional way of thinking is muscle movement techniques to improve function. There's always, so it really is physical therapy for the mouth. It is teaching those muscles to do what they're supposed to do. And myofunctional therapy always has four goals, no matter what program you learn. And it's to get the mouth closed, lips closed, tongue up, breathe through your nose, and correct the swallow pattern. Those are the four goals of every typical myofunctional therapy program. Um, Also, a typical myofunctional therapy education or course, kids don't do myo until the age of 8. So
Okay.
they have to be sitting and be able to pay attention to, okay, this is your first exercise. This is your second exercise. We're going to go through this. You're going to do it 2 to 3 times a day. Your mom's going to help you do this, et cetera, et cetera. And then you get this list of exercises and you go do them. And then you come back the next week, check them, recheck them, move on, progress to meet those four goals. You and I know as seasoned clinicians that muscle doesn't just start when you turn 8. There is muscle that needs to function when you are 2 days old. And
Hmm.
so a good clinician can take those skills that they've learned in those programs at the age of 8 that they're learning how to do those things, and you change it for every single age. And so
Hmm.
the dysfunction that you see in a 2-day old, that was, if it's not fixed, it's going to show up in the 8-year old, in the 10-year old, in the 25-year
Hmm.
old, in the 60-year old. So my job is to fix it when they're little, or at least raise awareness and attention and
Yes.
educate so that we can kind of monitor this so we're not everybody's on a CPAP, and we're building healthier humans and
100%.
functionally dynamic people throughout the lifespan. So that's kind
So
of what I
great.
do.
Yeah. And again, like it is, that's what I tell parents all the time. Like, I really want you and your baby to have a successful breastfeeding journey right now at 4 weeks old. But I
Right.
really, really want your 3-year-old to be sleeping with their mouth closed, not snoring. So we're not at the ENT saying we need to have our tonsils
That's right.
removed, you know?
And Yeah. And myo is just myofunctional therapy. It's a tool in the toolbox. Every
Hmm.
speech pathologist, every occupational therapist, every physical therapist, we all want to learn. We all have all of these continuing ed courses that we pull from. It's just a tool in the toolbox that we can access that will help with orofacial development from cradle to grave. Um,
Hmm.
and very important, very, very important in terms of sleep, breathing, eating, speaking, speech, um, and then overall head neck posture.
Okay, so why does it matter that our mouth is closed, lips sealed, tongue resting up on our palate? Why does that even matter?
I love that question. Because it it makes for the system, for a functioning system, right? So when you don't have, so our bodies work on a series of postures, right? And pressures. And so when you lose pressure system in the mouth, you lose pressure systems elsewhere. You change your breathing mechanics. You change the way that your jaw aligns and how that aligns to cervical spine and how that aligns to ribs and how that aligns to diaphragm and how that affects digestion, how that affects pelvic floor, how that affects knees and feet and weight shifts and all of those things. So you can't separate what happens here with what happens down below, but it's really good to have a good closed system up in the top, right? So tongue should rest on the roof of the mouth. Lips should be closed. You should be able to breathe quietly through your nose all day and all night. And that improves or facilitates optimal development of head and neck and jaw.
So a little mouth breathing is never optimal.
No, I mean, okay, so when you have a cold, this little kiddo, if they don't have a big
Hmm.
airway, then they are going to breathe through their mouth and they are going to snore. If you see that all the time, that would be I would
Red
want to
flag.
know about that.
Hmm.
But habitual snoring, that's never okay. Like if you're
Yeah.
snoring more than not, or more than 3 times a week, I need to know about that. Or as a clinician needs to know about that. Because it does change the way the structures will form.
Well, and I've learned from you that snoring doesn't have to be your classic, like there can be like even quieter forms of snoring. You've
Right.
told me about different apps, so there's different things that you can use out. Just lay
Yep.
your phone by your bed with your app. I mean, I've been brought to my attention like breathing sounds that I wasn't even aware of
Yeah,
through using those. Yeah.
I can't tell you how many times I listen to people snoring with an app because you can tell, like, is that through the nose? So you can snore in like 4 different places, right? Is it
Hmm.
through the nose? Is it the soft palate? Is it base of tongue? Is it down here? So you're trying to figure out like where is the impairment? Where is there some resistance?
Hmm.
How do we open that up in those areas to have the best patent airway possible? So our like nervous system functions better, our muscles function better, and then we function better. But yeah, I'm always listening to snoring.
Yeah.
Um,
So tell me about the connection because I can always hear it again and again. So the connection with night wetting. So yes,
mm,
there's an age where potty training and bladder is full and can hold urine throughout the night. But then there's also like beyond that when bedwetting is really not something we want to continue seeing. That's something you address a lot with your clients.
yes. So I'm always, the boys love to answer all of these questions. The girls get a little nervous, but I've been told that, bedwetting over the age of 5 is usually considered, that's the red flag, is anything over the age of 5. Um, First things first, with bedwetting, I always rule out constipation. So, constipated in my book, you are constipated until proven otherwise, right? And so I get the little charts out, the poop charts for all of these kids, even adults. And I'm like, all right, tell me what it is. And you're wanting that to be like long, skinny snakes, right? And so we kind of cleared that out first, and that's trying to figure out if that's the issue.
Yeah.
And then the second one is a sleep disorder or a sleep, um, kind of a red flag. Is there
Mm-hmm.
something going on in sleep that I need to know about or look at? Because if the body's not going through deep stages of sleep and all of the stages of sleep, they might wake up, and that's when they have an accident. And so you're just trying to make sure that sleep is as good as it can be as well. And also it determines, if it's constipation or if it's a pelvic floor issue, then I'm referring to my amazing pelvic floor therapist down the street. Um, but it
Mm-hmm.
certainly is a red flag for something else is going on, not
Right.
just that they're being stubborn and peeing it out.
Exactly.
It's never
Right.
that.
Right. Or like, don't be frustrated if like the bedwetting alarm is not helping your kid.
Please don't. Please don't, right? Because there's something, it just means like,
Yes.
let's dig a little deeper. And parents are so awesome in that, like, just trust your gut.
Yeah.
Trust more than you have, your child. So ask the questions. Don't be scared to ask the questions and let's figure it out.
Absolutely. And I think that that's what's so great about your work is that things that have never been considered through this lens, it's like bringing to awareness, like the whole bedwetting issue. It's like, really? Like, I don't just have to put my kid on medication for the rest of their lives or until this remediates itself, you know? I mean,
Right.
so that's
Right.
again like why it's so critical because I'm such a root cause person that it's
Exactly.
like, let's get to the root cause of what it is.
Exactly. Exactly.
Okay, so you see infants, I see infants. So the role of, mom struggling with feedings, babies having
Mm.
breastfeeding difficulties, the PT connection, myofunctional feeding support. Let's talk about that from your viewpoint.
That's my favorite question. Um, sometimes it's hard to get moms, especially, that these babies are born and they have this idea of it's going to be amazing. I'm going to spend the 3 months at home
Mhm.
and just loving on this baby.
Yeah,
And it hurts my heart when they're in my office, right? Because I
sure.
know that they're needing help. Um, but I do think I work really closely with all of my feeding therapists and my lactation consultants. They are my right hand in
Hmm.
all of this. And a lot of times it does take a team. So if you're having issues with a baby feeding, latching, breathing, suck, swallow, breathe, nervous system engagement, regulation, the what I always say, and this is not a quote that I said I came up with. It was Reggie, who was an amazing NDT therapist a long time ago. What happens at the hips happens at the lips. And so what you see here, you are also seeing the rest of the body.
Hmm.
And so sometimes if you can work on trunk control, decreasing asymmetry between right and left, working on tongue-jaw coordination, endurance, head control, posture, then you're going to get better outcomes in the mouth. So a lot of times we're teaming and saying, okay,
Hmm.
can feeding therapist is like, I need this, I need a neck. And I'm like, okay, and I need right and left and all of those. I Years ago when I first started practicing, torticollis was just an SCM involvement and we were doing all the
Hmm.
stretches and all of that, right? Um, I cannot be convinced that oral dysfunction and torticollis or plagiocephalus or all they go hand in hand. It's
Hmm.
peanut butter and jelly. So if I'm seeing asymmetry of the head, then I know that something is going on in the mouth. And you can
100%.
fix one or the other, or sometimes they fix at the same time. Sometimes I'm
Hmm.
just monitoring, but they all go together.
Yes, and I think that that's one of those things that it's like, why won't the torticollis like improve? Why are we still doing stretches at 8 months? It's like, well, did anyone assess deeper
Yeah,
what's going on?
exactly. So it's the other thing I say all day long. you were given four sides of your body: a front, a back, a right, and a left. And what you do to one side is going to affect the other side. This is going, the cervical spine, the back of your head is the back of your tongue, right? So, like, it's pretty close, right? So,
Mhm.
what happens in the front happens in the back. What happens to the right happens to the left. So, it's trying to figure out who's going to make the best impact to improve function,
Mhm.
whatever that functional goal is.
Perfect. Yeah, that makes a lot of sense.
Right? I think
And
so.
yeah, and I feel like the pendulum is swinging from like this segmented way of looking at the body to much more holistic.
I
Like
hope
people
so.
are, I do too, that people are starting to say, oh, we can't separate this all out. Like we have to have an integrated model here.
Well,
So,
I think largely, in the past, especially for PTOT speech, it was divided because
mhm,
of insurance, right?
yeah,
And medical, your medical model. And
mhm,
also, you can only learn so much. So you,
100%.
right? Like, so someone has to be a specialist in this area, and then someone needs to like geek out in this area. And so we have kind of separated a little bit, but certainly everyone needs to know, like, this is what I'm really good at as a therapist, and
Absolutely.
this therapist brings this to the table. So I'm going to tap into that when I need it.
Yes.
But the system, an individual in and of itself, it needs all of those things to work together. And so sometimes it might need you, might need me, might need someone else. We might need to bring
Mhm.
this person into the game. And I think that I'm hoping that that's where our community is going.
Yeah, I think it is for sure. I think that it's taking us a minute, but we're getting there for sure. For
Yes.
sure. Yeah, it's all right. It's all right. Okay, so you mentioned feeding therapy, so and I know you have therapists that work a lot on feeding. So in regards to like the sensory defensive kid, which is,
Mm,
my wheelhouse,
yes.
and then the oral motor dysfunction kid, which is, very common that we work on. So like a parent who's trying to understand a little bit about the differences in that. Um, Again, because they can present similarly.
100%.
So let's
100%.
talk about that. How we
So
differentiate that.
I think it's hard.
Hmm.
And I'm probably not the best person to answer because I'm a physical therapist. So
Hmm.
if a picky eater comes into the office, I'm not going to necessarily, well, sometimes I get involved. It depends. But I think when our clinicians are seeing that, the first thing is our eval is really long, right? So we're doing tons of parent questionnaires, trying to figure out like
Hmm.
what's the issue? What is the
Hmm.
root thing that's going on that parents are going to get the biggest bang for their buck with if we intervene so that they can go back to functioning and get out of our office, right? So they can go
Right.
back to life. Sometimes I think complex feeding certainly can be sensory,
Hmm.
more of that. I think it can be more motor. I think it can also be medical. Is there an EOE? Is there PANDAS? Is there, recurrent chronic infections going on? Are there digestion issues? Is there constipation? Is there reflux? Is, blah, 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 blah. Is it a combination of all three, which is usually
Yay.
what
Right.
happens, right? Um, the first thing is I never think that a kid or an adult is just being picky because it's a behavior. I think that that is just terrible.
Hmm.
It's our
Hmm.
job as a clinician to figure out what that behavior is and why, and then who is the best therapist for that kiddo or for
Hmm.
that adult, right?
Hmm.
So
Hmm.
if the kiddo can't even stand to be in their own skin and they are not being able to sit at a table and they freak out at the thought of food, that is
Hmm.
more sensory and that needs to be addressed way before we
Yeah.
start doing oral dysfunction. And it also
Hmm.
we need to rule out medical. So I think it's like, as my papa would say, like, who's on first, what's on second, trying to figure out what the family's goal is and what therapist is going to make those changes the quickest, and then
Mhm.
it might need another therapist in the back to kind of clean up some of the reasons why we might have gotten
Mhm.
there in the first place.
Mhm. Yeah,
Is it-
that makes sense. Yeah, for sure. For sure. And again, like you
Mhm.
can't always weed it out, but it's just
No.
having this, having a provider who has an awareness of all the different levels is so important, for
And then
sure.
educating the parents, right? So
Hmm.
like I think it's our job to say, this is what I'm seeing. I think there's also this could be part of the issue too. And this is my goal, but if we're not making progress, or maybe you start there,
Hmm.
go to Ashley's clinic. Let Ashley, that is what Ashley does. She is
Right.
meaning you. That's her wheelhouse. Let her do that.
Hmm.
And then let me talk to her.
Hmm.
And then when she needs to bounce back to me, I'm here. I'm not going anywhere.
Yeah.
So
Right.
it's just the communication between providers, and then determining what it is.
So your website is amazing. You have a ton of information and just like trying to
It's being redone
bring.
right now.
Well, I loved it because, I mean, yes, it can
Oh,
be overwhelming, but it also gives the depth of the things that you are looking at. So, like with what would you say like your wheelhouse, like the thing that you either see the most or the thing that you're like, I wish parents were more aware or even adults were more aware, like this is how we can really support for better
mm.
health. So like of all of those things which help bring awareness, but like for you personally in like what you're doing and you're seeing the most progress, like what do you feel like like your wheelhouse is that like this is.
I would say the thing that I love
Yeah.
um to do is nasal breathing and eliminating mouth breathing. I think
Mm-hmm.
everyone, like a Mayo mantra is tongue up, lips closed, breathe through your nose from
Mm-hmm.
cradle to grave. Just because you see mouths open doesn't mean that that's normal function. So from a NDT perspective, from my background is like looking at atypical development and making that more typical
Mm-hmm.
is what I think of. And so obviously mouth breathing is probably the thing that I see the most.
Most.
Snoring is probably the thing I see the most. With the infants, it's atypical posture, asymmetry between right, left, regulation, that nervous
Mm-hmm.
system not being able to regulate. I think that those are the things that I see probably the most, and the things that you can get your biggest bang for your buck with.
Mm-hmm.
Um, and then my speech therapist, certainly, how can we get these kids feeding? How can we get speech
Mm-hmm.
clear? You don't have to wait until they're 8,
Mm-hmm.
because the oral dysfunction is happening when they are 6 months. Um, and the other thing I would say about that is muscle muscle doesn't just get fixed and then you move on, right?
Okay.
So I I don't look the same. My muscles aren't functioning the same as when I was 30 years old or when I was 18.
Mm-hmm.
And so it's constant, just reassessment and education and making sure that we're in the best development now. And just because you fix it when they're infants doesn't necessarily mean that that's going to translate into adulthood. So because we grow and we change and we do different things, and we might choose a profession that requires like a lot of forward head posture. And so just constantly always looking at that and monitoring that. And I think that that's what I always like to see, is just following kiddos through the
Mm-hmm.
continuum and making sure that they're optimizing function throughout their whole entire lifespan.
Yes. Okay, so the last thing I want to ask as far as red flags, and so let's say a mom has needed support in the early weeks, days of life, let's say breastfeeding, bottle feeding were really difficult for them. Maybe they did or didn't. Like after that stage, one that 18-month, 2-year-old age, like what would be something where like those would be red flags that parents might say, you know what, we either brush this off or this is something that's kind of lingered. What would you say like some of the things you're seeing in your office that you're able to support the family with?
I would definitely say, every 2-year-old, you want their mouths closed to be able to
Mm-hmm.
chew,
Mm-hmm.
eating with mouths closed, certainly, and
Mm-hmm.
eating a variety in diet. Certainly Arctic,
Mm-hmm.
can you understand this kiddo? Um, because when speech is impaired, there's usually muscle involvement, and that's opening up a big box that's another podcast. But
Mm-hmm.
that's certainly one of the things. Can you understand your child? Can someone else
Else.
understand your child?
Mm-hmm.
Um, and then certainly mouth breathing,
Mm-hmm.
100% of the time. Can your child breathe through their nose quietly during the day and at night? Do you see them when you're driving in the rearview mirror? Is their mouth wide open? When they're watching TV, is their mouth wide open? That should be
Mm-hmm.
closed at all times. So I think that that's one of the big, big, big red flags. Um, and certainly snoring. Um, I think that would be it. Those would be my big
Yeah. Yeah.
ones.
I was
Am I
working with
missing
them.
any?
Yeah, no, I was working with a mom yesterday. Just made me think of something that would be great to get your feedback. The baby is 2 weeks post release of tether or tissue and making great progress with feedings and is doing well in that range, but the still having what I'm thinking is some reflux, some true medical reflux. And the mom is questioning, like, is this just my baby's temperament? And so it was making me think of even like the 1 or 2 year old. Like, I feel like some parents like just white knuckle through a lot of, I'm just going to
Yeah,
say dysfunction because they're like, oh, this is just the way they are. This is just
not
their temperament. And just having to talk to her about, like, no, you should be able to just lay your baby down and they should be okay not having constant stimulation. And I think that goes for moms who have 15, 18-month old, 24-month olds that are
100%.
maybe still waking up frequently in the middle of the night and having explosive temper tantrums. It's like,
That's right.
no,
It
like,
doesn't it doesn't have to be that. Or, like certainly rule out this component of all of
absolutely.
that. There's always a little bit of this, a little bit of this, a little bit of this,
Absolutely. Yeah.
but certainly playing a role in trying to figure out can this help? Can this provide support?
Right. And so, like, a person with your background could help with those things. It's not like, oh, you just need to parent them differently,
That's
or, oh, I need to go to a behavioralist. Like, again, like root cause for me, and the same for you. I would much prefer go see Ashley Larson and get to the bottom of maybe is their sleep poor? Is there
right,
constipation going on?
right, right. Like
Is
what's
that,
happening, right? I
yeah,
mean,
exactly.
behaviors is the output of what is going on here,
Internally.
right? So I think yeah, I think trying to figure out like what is it? And sometimes I know and sometimes we're just guessing, but the other part of that is developing this community that you can say, okay, I think it might be
Yes.
this, but let's go see my ENT friend. Let's get her to
Yes.
look. Go see Wagasbag in Thibodeau. Go see what her thoughts are. Go down the street. Like, but it's just trying to figure out what is this mom's concern? How do we attack this so that they are returning to function? And
Yes.
that is not going to snowball into a bigger
Bigger
issue
issue. Hmm. Hmm.
later.
Yes.
And I think that I think we can help with a lot of these issues.
I was going to say yes. And that's what's been so life-giving to me and my family is that the things that I feel like in the back of my mind, I'm like, this doesn't feel right. I just don't know. There's always been like a creative lens to look through that has just like validated, like, no, you're not crazy. Like
I love
that
that.
there is something. So
I love that.
thank you so much. Okay, tell people where you are and how they can find you.
Okay, so I am in Baton Rouge, off of Jefferson Highway, and yeah, we have 3 speech pathologists and a lactation consultant who is amazing, and then me and another PT, and then
Awesome.
amazing office manager who keeps me in line. So we're
Yes,
small.
yes.
It's a cute little clinic, and we love what we do.
Yes. Well, I love referring to you. It's great
It does.
collaborating.
It does.
So thank you so much. I appreciate you carving
Welcome.
time out for me this morning.
Anytime. You're quite welcome. You're
Well,
quite welcome. It's a
we'll talk
pleasure.
soon for sure. Thank you.
Yep. You're welcome. Bye-bye.
I hope you found this episode on the feeding solutions helpful. If you would like more information, please follow Sensory Solutions on Facebook or Instagram, or you can always visit our website at www.sensorysolutionsTherapy.com. Thanks so much for joining today, and look forward to seeing you next time.